Presenting at the meeting are the results of an ongoing phase 1 study. So we've not completed enrollment yet, but we have some very exciting preliminary results to share at the meeting. This agent is called ADCT-402, and it's a novel antibody-drug conjugate. The antibody targets CD19, which is an antigen present on most mature B-cell lymphomas, and the toxic warhead in this instance is called a PBD dimer, which is a cytotoxic agent that cross-links DNA. So the study has enrolled about 60 patients to date. We're seeing very promising early results. For example, the overall response rate that we've seen in the phase 1 is approaching 60% with a complete remission rate of close to 40%. And it's especially encouraging when you consider that the majority of the patients enrolled in the trial had refractory diffuse large B-cell lymphoma, meaning they had no response to their last line of therapy. This is notoriously a very hard group of patients to treat. There are no good standard agents for this group of patients, and even most investigational therapies that we try aren't terribly effective. So we're very encouraged by this early overall and complete response rate noted in this study. There's a couple of things to sort out with this agent still. We're still trying to optimize the dose and the schedule, so we find the right balance between efficacy and toxicity. But we feel like we're getting close to that in the phase 1 study, and once that is done, we'll move on to phase 2 studies in a more defined patient population. So we envision testing this agent in an expansion setting in relapsed and refractory diffuse large B-cell lymphoma. And if the agent looks as promising in the phase 2 as it looks now, it could definitely become an attractive therapeutic option for patients with relapsed and refractory diffuse large B-cell lymphoma, particularly patients who are transplant ineligible. And by that I mean older patients, patients with comorbidities, or patients who have failed prior stem cell transplantation. They have no good options commercially available at this time, and so if this drug were to become available, it would be a therapeutic advance for those patients.